3 months ago, if you wanted to renew a prescription and called your doctor, you would be told, I'm sorry, you have to come into the office and we will do it in person. Uh, 3 months ago, just after that, we received emails from our doctors saying, if you get sick, the one thing that we don't want is for you to be coming into the office. We want to be able to do this remotely. Do you see this as a permanent change in terms of the structure of how healthcare is delivered? And what are some of the other advantages that Canadians can find? For example, Canadians living in rural and remote areas. You mentioned elderly people, persons with disabilities would be another example. What do you see as some of the advantages here?
I think first off, I think there's no turning back. I think when necessity is the mother of invention, isn't it? And when you have technology that can help you bridge time and space, and people can see the convenience of that, they can see the utility of that because they have to, because there aren't many other alternatives. It's one of the greatest drivers of adoption of our services that I mentioned earlier. And I think the pandemic has done that, because what's been holding us back, and things have been holding Canada back in this regard, usually are bureaucratic policies, antiquated policies that have been in place. And the healthcare system is one of the last systems to really go through a digitization. You'll still see fax machines in healthcare facilities, and it just kind of makes my head shake and cringe at the same time to say, these are no longer required. Why are we not moving forward? Then the pandemic hit. And when the pandemic hit is now everyone needs healthcare. What solutions are available to them today? They can't go into the clinic, or they don't want to go into the clinic. No one wants to go into the ER because of fear of contracting COVID. And so now, some of the bureaucracy fell away. Still, rules and regulations are really, really important here, but some of the roadblocks that were in the way ceased to become roadblocks. And very quickly, remuneration approaches changed, et cetera. Virtual care fee codes, as an example, where this is how doctors would get paid for a virtual visit. Those became almost ubiquitous across the country. And, consumers and patients are now benefiting from that technology. And now I think once you hand it to them, there's no turning back. So if you can now have a virtual visit, it takes 15 minutes maybe, it could be from the comfort of your home or wherever you are, and you can get your prescription refilled without having to take time off work, without having to go sit in a doctor's office. Why would you ever want to do that again? It's like giving people access to an ATM and then later saying, we're going to take the ATMs away, back into the teller lineup you go into the bank to do your banking. So I don't think there's any turning back on that front. And I would say that, when you offer people the convenience in a safe way and they can have a little bit more of their life back, there's no turning back from that.